Assalamualaikum and good morning. This is Dr. Tazeen, one of the mentors at StudyMedic and StudyMRCPI, and we are here with beautiful series for your OSCE preparation, the OMR series, which are specially designed to make your OSCE preparation up to mark. And I am here with another structured discussion for you guys. So the basic aim is that to learn together and to succeed together, and I welcome you all for this series. And if you have not subscribed the YouTube channel of StudyMedic, subscribe now to get more benefit from this series. So here we are actually discussing a structured discussion about a sexual assault victim. You will get the candidate's instructions, and after that what you have to do is that you have to read those instructions carefully, and then the examiner, they will ask you few questions which you have to answer. Whenever you are starting any task, the most important thing is that you should have a clear idea that this is a structured discussion or this is a patient simulated task, and then you will move forward. So here the candidate's instructions are with you, that you are the registrar on duty and you are seeing a patient who has presented to the accident and emergency department at 1 a.m. claiming to be raped 1 hour ago. Now you have 10 minutes to answer the examiner's questions. So once you read the instructions, you have to clear your mind, and then what you have to do is that you should have a clear idea that what actually it can be all about and how you will answer all these questions. The first question says that what would be the immediate care of the patient. So when we talk about immediate care of the patient, always keep in mind that your intro with the patient, your first encounter with the patient, that is very important as far as your task is concerned, and you have to confirm the identity of the patient, which comes under patient safety as well. Followed by that, there are emergency situations. If there are any emergency situation at that time, you have to manage that, and then a detailed history will be followed, that you have to take a detailed history about the whole incident, and you have to perform examination of the patient. As you know that these patients are at the risk of development of pregnancy, that 5% of the cases they can have pregnancy, so the preventive measures should be taken to prevent pregnancy, as well as you have to do the screening for prevention of sexually transmitted infections. And forensic evidence and the timing of forensic evidence is very important, so that should be very clearly in your mind. So the next question comes that how to manage any emergency, how to tackle that situation if any emergency is there. So the many women who are complaining of sexual assault and they have no injuries, or they have very few injuries which needs not to be sutured or nothing to be done. So all the injuries which are present in a victim of sexual assault, they should be treated with the basic first aid care. The minor injuries that do not require suturing should be cleaned initially, because samples can be taken from these sites for DNA evidence, and each injury should be described in the clinical notes. So how you have to describe the injuries, that is important, that what is the shape of that bruise or laceration or that injury, what is the depth, whether there are any color changes for that injury, and whether it is tender or non-tender. And if it is possible, you can even use a measuring tape to measure the size of the injury and its distance from the fixed anatomical landmarks. Like these landmarks can be bony prominences. For example, it is 1 into 3 centimeter purple bruise 5 centimeter from the knee joint, or you can say if there are injuries on the arm, you can say that it is 1 centimeter or 2 centimeter from the elbow joint. So you can use the fixed anatomical landmarks for the description of injuries, as well as you have to describe their size, their depth, and their discoloration as well if it is there. Okay. and a forensic medical examination. A digital camera can also be used for the injuries, or if you have to use it. Okay, so then there comes that how this patient should be managed. That is the most important thing, that what is the step by wise care of this patient. So you have to record the all the details of this patient. You have to ensure that these notes, they are correct. This all information which you are actually recording, this is accurate information. You have to avoid any discrepancies if they are there, and you have to be non-judgmental in such cases. Okay, and you have to believe that whatever the patient is saying and whatever the complainant has to say, that is actually right, and you have to believe that. And there should be a positive encounter, which can help with the future consultations, as well as which can help with the satisfaction of the patient. Okay, so note down the time and place of the incident, the nature of the event, whether there is use of any drugs, alcohol, or which were used to facilitate the assault, or exactly what happened and where and with whom this whole event took place. That is important for this patient. This will be followed by the examination of the patient after collection of the whole information, that if the woman, she agrees that the samples can be collected, so you have to collect the forensic evidence for this patient. For that, you have to advise the patient that she should not wash or wipe the areas, she should not eat or drink anything, and you have to tell her that she should not pass the urine. Then you have to contact the police or the sexual assault referral center for the discussion, and early evidence kits are available for which the sample can be taken. So what these actually early evidence kits contain, they contain a mouth rinse which can collect the vital evidence if oral penetration is reported. Then mouth swabs are there, urine collecting pots are there, toilet paper is there. So these are actually the things which are there in the early evidence kit, so which can help you to get the forensic sample taken. And as I already discussed, that for each injury you have to note down the exact type of the injury, what is the actual location from anatomical landmark, size, pain, shape, discoloration. All these things, they should be mentioned in your notes. All these assault victims, they need prevention of pregnancy, as 5% of the chances are there that how to prevent pregnancy. So what can be offered, that you have to offer them emergency contraception, and this can even include the intrauterine contraceptive device. The contraceptive device is the most effective form of emergency contraception, and it can be inserted up till 5 days, as you know, and after the first unprotected sexual intercourse in a cycle, or within 5 days of the earlier estimated date of ovulation. Which one is later? Ulipristal acetate emergency contraception has been demonstrated to be more effective than levonorgestrel, and it can be prescribed to the patient up till 120 hours after unprotected sexual intercourse. And then you know that levonorgestrel is also there, which you can prescribe up till 72 hours, which is important. Once the prevention of pregnancy is done, the other important thing is that you have to prevent your patient from the risk of sexually transmitted infections. And most of the screening for sexually transmitted infections, it is usually done 2 to 3 weeks after the assault, because the incubation period for various pathogens is there. Prophylaxis against bacteria, sexually transmitted infection is rarely offered, but it can be considered in those patients who are at the risk of infection. Blood testing at 3 months should be offered to screen for hepatitis B, syphilis, and HIV. And HIV post-exposure prophylaxis should be discussed with all the women who are actually the victims of such incidents. and unprotected anal intercourse, it carries the risk of transmission of sexually transmitted infections. So that should be taken care when you are actually managing such cases. So then it is very important that these sexually transmitted infections, they are actually the prevalence is higher in those areas which are actually the more at the risk of intravenous drug abuse, or you can say that sub-Saharan Africa, or the patients who are actually homosexual. So these things should be taken care, and in such cases the post-exposure prophylaxis, it should be started as soon as within 72 hours, and it should be continued for 4 weeks. These two things are important to note, that in underprivileged areas, or those areas which are at high prevalence of HIV and sexually transmitted infections, post-exposure prophylaxis is important to be prescribed to the patient. And an accelerated course of Hep B vaccine should be offered to these patients at 0, 1 and 3 weeks, or 1, 2 and 1 and 2 months, and then a booster dose can be given at 12 months if it is needed. Okay, forensic evidence, as I told you that it is important. So the forensic evidence is actually the collection of the DNA material and other evidence. So if the woman says that she is willing for the forensic evidence, then even the forensic evidence can be collected without involving police, giving the woman the opportunity to consider her options, and whether she want to report the assault at a later date. But there are certain time frame that at which time you should collect that forensic evidence. This forensic evidence is actually that in generally swabs can be taken up to 7 days after vaginal penetration, 3 days after anal penetration, and 2 days after oral penetration. And a toxicology screen should be sent from blood within 3 days of the assault, and from urine within 14 days of the assault if a drug facilitated sexual assault is suspected. So this is actually all about the sexual assault, that how the structured discussion is being done, and these are the exam questions which are asked by the examiners, and you have to answer these questions in a systematic way to achieve higher marks. I wish you all the very best for your exam. Have a great day.